Oh my God. Wow. That was amazing. I felt that like all the way down.
Relax.
Wow.
Also, you broke
my glenoid.
So
what happened is I was in an ATV accident. I rolled an ATV and I like came down right here on this side of my arm, like 10.5 feet, like flew, and then just everything. And it broke my glenoid.
So now there's also even, like you said,
there's a screw that's in there holding it together.
Perfect. How you feeling?
Much better, like a million times better. Like a new chick. Seriously, like wow. I think I may be able to sleep through the night. My arm would have been going numb by now, and it's not. It's crazy. I don't even know how to feel about it. Like honestly, like I've gotten so used to the pain. Like it's crazy. Yeah. Beautiful.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, as you were telling me, the main chief complaint is numbness in that left arm.
Yes, sir.
Okay.
And burning in my left palm, like just burning sensation where I just kind of want to cut my arm off at certain times.
Okay, so I mean, as you can tell, it's completely affecting your daily living.
Yes.
Okay.
I cannot sleep through a full night of sleep ever. I'm up every hour, every 2 hours, walking it off, shaking my arm, trying to get it to just stop hurting so that I can lay back down.
Okay. So yeah, we're going to go through today, I want to go through ranges of motion, we're going to do some orthopedic tests, and I kind of want to get a baseline, see where you're at, everything that's going on, and we'll go from there.
Yes, sir.
Alrighty. So, what I'm going to have you do, I'm going to have you look all the way up in the air. Any issues with that? Any pain, tenderness, anything like that?
Yeah, just a little tight.
A little tight, okay. Look all the way down to the ground. Any issues with that?
Just tight.
Okay. I want you to bring one ear to one side and then to the other. Any issues there?
Just really tight.
Okay. And the other side?
I get a little pain like back here on the right side.
Okay. And then if you were to look over at the shoulder?
Just a little tight.
Just tight? Okay. Alright. So now what I want you to do, I want you to sit up nice and straight, and I'm going to push down on the top of your head. Any pain when doing that?
No.
Okay, we're going to turn your head to the side. Any pain with that?
A little bit.
A little bit, where at?
Like right here.
So again, that right side.
Mm-hmm.
Okay, and then we're going to turn your head to this side.
Ooh, it was like a burning sensation right here.
Okay, burning sensation right through there. Okay. Now, what I'm going to do you have
hair tie?
No. I just want to make sure and go over the ears like this. All right, I'm going to lift up. Any increase, decrease of pain, or is it the same?
Same.
Okay. All right. What I want to do is I'm going to have you lay face down for me. Actually, first, I want you to kind of show everybody. Now, I know you have fractured your clavicle, and now, how long ago was that fracture?
That was when I was 23.
Okay.
And I'm now 36.
Okay. So, I mean, you guys can really tell. So now looking at that, you can see how that clavicle, how it's healed compared to the other side, and everything has been a factor from this.
Yes.
So how many years has this been going on for with that?
Ever since about 20.
Okay, about all that.
Yeah,
all
but
okay.
like ever since after that they did the surgery, it healed up, and then I just started having the numbness and stuff.
Okay, I want you to put your arms like this for me. Now I'm going to push down on this side. Don't let me, okay? Good. And then if I do the same thing on this side. Good. Okay. Now if you're when you're moving your arms around, do you notice any restriction with like range of motion? Like if you move them around, is there any?
This one,
that one,
and it always like
What about when you go up? Do you know?
Yes, I get super sharp pains all in this region.
Okay. All right. The reason that I had you do that is because after the adjustment, I'm gonna have you go through those ranges of motion like that again, and I want you to let me know if you notice a difference. Okay.
Okay.
All right, so now what I'm going to have you do, I want you to lay face down for me. Okay, and then here, I'm going to bring your hands around right, yep, just like that. All right, so how I start every adjustment is we're going to scan the entire body. From here, what we're going to be doing, I'm looking for any imbalances. So I want the right side to be like the left. So I'm looking for that symmetry. If anything is tender, or if I find any taut, tender fibers, those I will also be kind of addressing, especially with the soft tissue work. So I'm going to start palpating in that cervical spine. Is anything tender to the touch when I push in here?
That right there.
Right here?
Very much.
Okay. So she's literally telling me right at T1, right when I push in, is very tender. Okay. Okay.
Yeah.
So we're gonna stay away. I understand that's tender. So we're gonna keep going on. So I went from the cervical spine into the thoracic. Any issues through here?
No, sir.
Good. From the thoracic, we're going down into the lumbar. Any issues in
A
here?
little tender there.
Left side or right side?
Left.
Left, okay. And
Yes, tender there.
tender here.
Left.
All right. What about on the right SI joint?
No.
Directly over the sacrum?
No.
Left
There,
SI.
yeah.
Okay. So we got left SI pain, and then some pain at that T1 or the main spots. So I want to come down here and I want to check out the leg length. So actually, I mean, it's very close, as you can tell. Maybe the tiniest bit short on the left, but it's super close, which is a good thing. Let's go ahead, and what I first want to do, I'm going to use the hypervolt. I just want to relax the muscles through here, and then we're going to also do that low back as well, okay?
Yes, sir. Wow. Give me one of those.
I know, these are actually pretty powerful, aren't they?
You're amazing. Wow. Whoa, horses.
Feeling a couple sore spots.
Tickles a little bit.
We're going to go ahead and we're going to start off with the adjustment. Now, I know you've been adjusted before in the past, but not by me.
Right.
So, other chiros. So then also, yeah, at the end, just, kind of let everybody know with the, a little bit of a difference from what you're used to me. So we're going to start off T1 on this left side first.
Oh my God.
And drop down T2 on the right here. But that other side, you felt how that pressure just came.
That was amazing.
Good. All right. What I want you to do, I want you to take a deep breath in and exhale out. Good. I'm going to come down a little bit more. Inhale and exhale out for me. Good. Okay. So now we got some good movement up top. Even just checking at the leg length. So now, when doing that, she actually started pulling a little bit shorter on that left. So, when we realign this, now we're showing a little bit more issues. They're now showing more from that lower back. What I'm gonna do, I'm gonna stabilize on your sacrum, just like this. I want you to raise this leg up as high as you can for me. Any pain, tenderness, tightness with that?
A little tightness.
Okay. Now raise the left side for me. Now, you notice that leg?
Goes way higher.
Goes way higher, correct. All right, so what I'm gonna have you do, and I'll actually show you first what's happening. So if you wanna look up here. So what's happening is your sacrum is pointing more towards the left side. So it's angled towards this left leg. So when you raise the left leg, the ligaments that are going across here are looser, which is allowing that leg to raise up higher. Where on the right, it's already tight and it's restricting it.
Right.
So what we're going to do a P to A, which means posterior to anterior. We're going to do a drop. So we're going to do a drop technique, and then also when I do the drop, I'm going to do a torque, and we want to rotate that more to the right side.
I'm all for it.
Okay.
He knows a lot of technological terms there.
All right.
So back in this position.
Yep. I'm going to have you cross this foot over this foot for me. Yep, just like that. Table's going to come up from below. Uncross. Bend this knee for me. Yep, good. There we go. And relax. Raise that right leg up again for me. Do you notice the difference?
Yeah, a lot. It went a lot further, right?
Yeah, it did. And was it easier to lift that up?
Yes.
Good. And there we go. Now I want to come back here. Check that leg length out. Now, as you can tell, after that, it's completely balanced again. So, what that was telling me, you know, we had that issue up top that was unbalancing the legs, and then that issue right at the sacrum. So that those two adjustments really just realigned everything. Okay, what I want you to do, I want to make sure that we cleared out the thoracic spine, because from there I want to do the Y strap. So what I'm going to have you do, I'm going to have you stand up for me. Have you stand right here in front of me. Good. Arms out by your side. Okay, hands up and over mine. Yep.
Like that?
Just like that. I'm going to lean you back on me. Squeeze your elbows together.
Oh my God.
Good. Alright, I'll have you take a seat right here for me. Face that way. And now, just want to make sure we cleared all the thoracic spine out. When I say cleared out, I want to make sure that there's no pressure left on the nerve. So I did a prone thoracic adjustment. We've done a standing intercostal adjustment. Now we're going to do the supine adjustment here. I'm going to have you give yourself a big hug. Now what I'm going to do, I'm going to have you take a deep breath in. I'm going to bring you down. Exhale all the way out. There we go. I'm going to go up just a little bit. Perfect right there. Deep breath in and exhale out. Good. Alrighty, nice and cleared out. Alright. Perfect position. Just relax your arms for me.
Like to the side or?
Yep, or on these. Yep.
Okay.
Alright, so we are going to do the Y strap. Now this is that manual decompression. We're going to get movement from up top, just going all the way down with this, okay?
Okay.
I'm going to have you lift your head up. Good. If you can pull your hair through. Perfect, thank you. Okay. Now this is the first time getting the Y strap done?
Yes. I'm like, I don't know, it feels weird.
Alrighty.
Oh my God. Wow. That was amazing. I felt that like all the way down.
Relax,
to everything. Wow. Wow. That was cool.
How would you describe that?
Amazing.
I'll have you come on up.
Oh my goodness.
Do you notice a difference?
Huge difference. Like just so much looser everywhere.
You feel how that
Wow.
decompresses?
Yeah, because I do a lot of yoga and they're always telling us to like elongate our spine and you know what I mean and all that stuff and wow, that did it for sure.
So now obviously first time getting adjusted by me. I know you've been to chiropractors before.
Just one and
Just one.
Yeah.
Have you noticed the difference between
him and you?
Yeah.
You have a huge difference. No offense, but he's much better. Much. You explain everything and like you actually crack things. Like I never heard anything crack any adjustment I've ever had by the other guy.
Gotcha.
Yeah, at all. And
Okay.
he told me not to crack my neck. that is really bad.
Not to crack your neck yourself.
Right.
Yeah, yourself, just because when you move things, you may be moving a bone further out of alignment than what it should be. So that's the reason why they would tell you that. But okay, yeah. How is everything feeling?
Much better.
I want you to move your arms around. Do you notice a difference?
It's still a little like.
So,
I think it's the glenoid thing that's broke, which is screwed up in there.
Gotcha. So what I want to do also, turn and face that way for me. Entire body. All right. So she does still have a little tightness in that area, but one thing that has happened. So obviously, you guys remember the clavicle that was broken. Now also you broke
my glenoid.
So
what happened is I was in an ATV accident. I rolled an ATV and I came down right here on this side of my arm, like 10.5 feet, like flew, and then just everything, and it broke my glenoid.
So now there's also, even like you said,
there's a screw that's in there holding it together.
So so we have a little bit to work with. Now what I'm going to do, just because we've done all the adjustments that we can do on the spine, we got obviously, I mean, you can tell a complete difference, right?
Yes.
Okay.
The sound alone was like, whoa.
What I want to do, I just want to work on the soft tissue with you a little bit, just so we can try to relax some of those muscles. I know obviously with having a surgery and getting that done, it may not ever be back to 100%. But
right.
if we can, ease that up, get things a little bit looser, that's going to be the game plan.
I don't know if it has a lot to do with, I have a titanium plate, 8 screws and 2 pins in my right ankle, and took a 357 through my decap.
Yep. Well, that was why we didn't do the leg pull for you, just because of that ankle and the knee. Not going to do anything. Yep, not going to do anything to mess with that. Okay. So we're going to be doing a few things. It's all going to be...
We definitely need to get one of these.
all on that left side here. Okay. What I want you to do, put your arm on this shoulder for me. Nope, on my shoulder. Yep, just like that. Good. Probably pretty tender.
It just feels lazy. But yeah, it's tender a little bit, just right in that region. Like the armpit. I know that's pretty much what your glenoid is, right?
Yep, yes it is.
I know the doctor told me that was the most impossible thing you can break.
And you did it.
And I did it. One of a kind, that's for sure.
Alright, relax your arm. Yeah, so not only do I address the spine and bony tissue, but I also work on soft tissue, just because you got to realize your soft tissue is what's pulling on your bones. So if this is all tense and taut muscle fibers, as many adjustments as I may want to do, your muscles are going to want to keep pulling that spine or that that body part out of alignment. So if we can relax these muscles, you can actually hold your adjustment longer.
Thank God. Seriously. Because the guy that I was seeing, he wants me to come twice a week. And I'm like, I can't. I have 2 kids, a full-time job. I don't have time nor money for that. I mean, my insurance covers it, but still. It wasn't helping any, you know what I mean? And he's like, oh, well, you gotta go more than, to see results. And I'm like, well, I should feel a little bit better, shouldn't I, when I leave? I already feel amazingly different.
Yeah, that's why when I go through and do an adjustment, that's why, as you can tell, and as you see in my videos, and as obviously firsthand now when I see a patient, and even after one adjustment, you're going to notice a change.
Yes, I do, completely. It's crazy.
Yeah.
Wow.
And then imagine, so
your husband's gifted.
I agree.
Wow.
Now imagine if you were to get this adjustment, once a month, just to get everything realigned. And
sign me up.
Yep. Yeah, so this is when I go through a full body adjustment. You know, I'm working on, as you know, like the soft tissue, the spine, and I'm getting as much movement, and I want to get as much pressure off the nerve with, you know, each adjustment that I do.
As much as we like you, we don't want to see you that often.
Right.
That also.
And that's awesome.
Yeah, like you said, you have kids, you have a job. It's hard to commit to a twice a week or 3 times a week schedule.
Yeah.
You know, as you said, you know, you have insurance. It's not even the money, but it's literally the time.
Yes.
So that's why, you know, when I do adjustments, I like to make sure and be very
Relax.
thorough. And yeah, I want to make sure when I do things, I want them to stay for longer, like the adjustments to stay and to hold longer. So yeah, typically a lot of my patients here I have on a monthly type plan. And yeah, you know, obviously you know your body better than anybody, so you're gonna know when you start feeling things out of alignment, out of whack. I have some patients that come every 2 weeks. I have some that come every 2 months. But after people get adjusted by me,
they don't want anybody else.
Yeah,
I can tell why.
Yeah, they want to keep coming back, and I love it.
Don't want no mediocre.
No, but you know, and that's the thing. I purposely spend a little bit more time. I book out my patients like that purposely. I like to spend, you know, 20 minutes with somebody. I want you to really get a full, thorough adjustment. So when you leave the office, you know that, wow, like I feel better, and you noticeably
And
can tell the
late
difference.
nights don't matter neither. That's awesome. I was like, wow, that's so cool.
Exactly. Yeah, because a lot of my patients, you know, they are coming from out of town. And, you know, I'm open weekends, and I know people's schedules are hectic, and, you know,
Beautiful.
Yeah, so I just try to accommodate everybody.
Awesome.
Perfect. How you feeling?
Much better, like a million times better. Like a new chick. Seriously, like wow. I think I may be able to sleep through the night.
Yes, let me know. You can send a message.
Like
you can
sitting
text.
down like this, my arm would have been going numb by now, and it's not. It's crazy. I don't even know how to feel about it. Like honestly, like I've gotten so used to the pain. Like it's crazy. Thank you guys very much.
Of course, of course. You got my number. Text me. Let me know how you're feeling tomorrow, the next day.
Drink lots of water, right?
Drink lots of water, yes. One thing. So when doing the Y strap as the first time, you know that was a ton of movement. You may be a little bit sore. When I mean sore, you know, like after like the first time working out in a long time, you have like a strong workout that next morning, you feel like that soreness. You may have that soreness. If you need to ice, 10 minutes on, 10 minutes off. You can do that throughout the evening. Also, what would be good is, yes, like we talked about, drinking a lot of water.
H2O.
Yep. And then by 48 hours after that following day, all that, if it is sore, completely will be a lot more loose, have a lot more, you'll notice more range of motion, just those little aches and pains. You won't be feeling.
Like this would have been gone numb by now and been radiating pain to my palm, and it's not at all. It's crazy.
Good.
Amazing.
Perfect. I'm Dr. Joseph Cipriano. If anyone is looking to schedule an appointment, go right to the website, drjosephcipriano.com. Send a message. I typically respond usually within a day or two. And yeah, I'd love to get you in here. Have a good one, everybody.